Thank you, Arjun. Thank you thank you to the Center for Clean Water Technology for inviting me to be here, participate. I think the presentation's been great, very technical. It's been a pleasure working with Arjun and his group since 2016 on emerging contaminants. It's been extremely useful work for the health department to work with this group in the emerging contaminant realm. I do feel, my name is Scott Alderman. I'm an Assistant Director of Bureau of Water Supply Protection. Bureau of Water Supply Protection, as Assemblyman Engelbright said this morning in the opening comments, I'm going to provide the policy perspective for all the science that we've seen today. So I do feel like I should apologize in advance because we've seen a lot of interesting technical presentations, and you're about to see a very dry regulatory presentation. Arjun did an excellent job. I don't think I've ever seen you present that fast. So you've done an excellent job to get us to 15 minutes fast right now. I'm not going to hamstring those efforts. I'm going to go through this very quickly and just very matter of fact. The agenda that I had here was 3 items: emerging contaminants as defined by the Public Health Law, Section 1112. I also had UCMR 5 on here on regulated contaminant monitoring and the bipartisan infrastructure law. I think I'll really just focus mostly directly on the emerging contaminants. As you can imagine, being a regulatory agency that has to implement the federal standards and the state standards and take legislation and work that into state code, it's been a very challenging and interesting week, particularly for me this week since Wednesday. So without further ado, just to get into, I'm sure I'm not missing anything here. In December of 2021, we had amendments, legislature passed amendments to Public Health Law 1112. And what that did is it required the department to promulgate regulations. So what that means is we take the legislation and then we have to write it into the state sanitary code, because the state sanitary code is what we are using to regulate water purveyors in New York State. Pretty aggressive time frame. Legislator gave us 180 days to promulgate these regulations. And so what I'm going to be presenting here is essentially what the law says that we need to do. Just trust me that we are doing it, and we're up against that 180 days. So very shortly, you'll be seeing the product of, or the fruits of that labor. 1112, before the amendments, established emerging contaminants. Emerging contaminants being defined as compounds that don't already have MCLs, they're anticipated to occur in public water systems, and they pose a potential hazard to human health. And that public water system should be looking for these contaminants on a triennial basis or every 3-year basis. So what they also directed, or what the legislation also, or that law also directs us to do when we're looking for those compounds, or we're looking to define those compounds, is to look at the unregulated contaminant monitoring. So look at the different CMRs that the EPA has, look at the different chemical candidate list that the EPA has. Look at substances that our other state partners are already regulating. Look at pesticides EPA is already looking at. Look at substances that the DEC, our partners at DEC, might already be looking at. And of course, look at recommendations, or take into consideration the recommendations for our Drinking Water Quality Council, which was established around 2016 in an attempt to address emerging contaminants in New York State. Really, for New York State to develop more of a US EPA unregulated contaminant monitoring rule of our own, so that we didn't have to wait for the federal government to stick to their 5-year cycle. So I think that was really the idea at its inception. So the amendments that were signed into law in 2021, and really through various amendment processes, technically 2022, officially established these contaminants as emerging contaminants. I'm not going to go through, you've already had the PFAS alphabet soup. What you're seeing here, for the folks that are in the know for analytical methodologies, you're seeing the 533 EPA standard method 533 contaminants. These have been defined as emerging contaminants, the first list of emerging contaminants. And there was also language in that amendment that said that we were going to assess, the health department was going to assess these additional compounds to determine whether or not they were going to be listed as emerging contaminants. And I see there's a few players on this list that are specifically applicable to Long Island area. 123 TCP is something that we've looked at on Long Island for a while. 11 DCA is something else that we're familiar with on Long Island. So this is just in the legislation as a group of compounds that may be assessed to possibly be listed as a second list or next list of emerging contaminants. So what the public health law also requires us to do as a health department is to come up with notification levels. So they have to be, the notification levels have to be equal to or lower than any federal lifetime health advisory. So that first point right there is something that's given me some heartburn, particularly this week, given the advisories that came out earlier from the EPA. If no health advisory exists, the notification levels must be determined based on the best available science, and that we have to take into consideration recommendations from our Drinking Water Quality Council. So essentially, we have to come up with a notification level at which, if it's confirmed that these emerging contaminants are in drinking water, there has to be a reaction, and that action is a notification to the public within 90 days is the time limit on that. This is just some other regulatory authority that the public health law gives the commissioner. Here's the slide I was looking for on the specifically on the notification levels. So when it's confirmed to be present in drinking water above the notification level, PWS has to take steps to notify the public. Those steps by the statute were within 90 days. There had to be a notification within 90 days. The commissioner may require that the PWS take action, so that's just loose language that's in the legislation that may allow for additional actions to be taken if the compounds are found above the notification level. And again, this is just some language in the law that the commissioner is going to have the ability to identify ECs once every 3 years, and that every 3 years we'll be updating the EC list. Put this slide in here because this is part of one of those items or one of those elements that was in the notification levels, is that we would confer with the state health department, would confer with Drinking Water Quality Council. So we had 2 meetings with the council after the legislation was passed, and what we did was the health department presented to the council what we thought the steps forward could be that would be in step with that legislation. So we had a meeting on March 10th, 2022 and May 2nd, 2022. I believe both meetings should be available on our website at this point. So if anybody didn't have an opportunity to see it, I would recommend taking a look. What we proposed to the Drinking Water Quality Council was to have 4 PFAS that we feel there's enough testing and toxicological information to establish MCLs for right now. So not to have them on this notification list, but to have them on our MCL list. And those would be PFNA, PFHXS, PFHPA, and PFDA. And some of the thought process that brought us to these compounds is that the half-life, toxicology, and structural similarities that they had to PFOA and PFAS. 10 ppt was the number that we were advancing, and we are advancing as MCLs for these compounds. The idea there is that they are health protective. It's feasible to achieve those numbers, and that we already had a precedent in New York State and other states for numbers in that area. Treatment for 6 PFAS MCLs will likely capture the treatment needs of co-occurring PFAS. So that's something that we've seen in the occurrence and co-occurrence data that we have been able to collect since we've already had MCLs for PFOA and PFAS, that we were going to capture. These compounds exist in mixtures, and that we were already kind of capturing these compounds with a treatment that we were either had already been installed or that public water systems were planning to install because of violations for PFOA and PFAS. And the final piece of that meeting, or the 2 meetings for the Drinking Water Quality Council, is that the Drinking Water Quality Council recommended that we evaluate a summing approach. So we advanced individual MCLs of 10 for each of these additional compounds, which would give us 6 PFAS specific MCLs in New York State, because we already have PFOA and PFAS. And the Drinking Water Quality Council recommended that we assess a summing approach. So that is something that we have also been doing in the interim as we prepare for publication in the State Register. So just really quickly, to draw a line or make a distinction between a notification level and MCLs. And again, I think it's germane to the presentation that I'm making here because the Center for Clean Water Technology has been involved with us from the beginning in trying to establish MCLs for 1,4-dioxane and PFOA and PFAS. We promulgated those regulations or those MCLs in August of 2020 for 10 parts each for PFOA and PFAS and 1 part per billion for 1,4-dioxane. So what an MCL gives us is it requires a public water system to regularly monitor for contaminants, notify the health department and the public of confirmed exceedances, and work with health departments on a timetable to bring the systems into compliance. So the big difference between MCL and the NL idea that I just proposed to you, or that is in legislation, is that the MCL is it's enforceable, and there is a timetable of compliance that becomes established that you have to come into compliance with that MCL. So an important distinction between those two. And yeah, I'll stay away from health advisory levels. So again, MCLs are enforceable standards that require corrective action. So as of February 2022, nearly all public water systems have results reported to local health departments. Those data are reported into our state drinking water information system, our SITWIS database. And there's an important caveat in the regulations for any organic contaminant. It already existed in the code before we added PFOA and PFAS, is that if you have a contaminant like PFOA and PFAS and it's detected under your required monitoring, whatever analytes can be returned from that method that you chose, you have to go look for those. So though we only had MCLs specifically for PFOA and PFAS, we had a mechanism in our regulation that we were getting occurrence data for 537, 537.1, or 533 contaminants. So we have a good amount of occurrence data for a suite of PFAS contaminants as a result of the regulations that we've been implementing since 2020. And so again, we just threw this in there to draw a distinction between notification levels, MCLs, MCL violation, required actions that have to be taken, a tier 2 notification within 30 days. And here's a table we threw together just quickly to show MCL violations that we have as of April 2022. So you can see we have 192 total. Really, this is showing impacted systems. So 49 systems that would have just a PFOA exceedance, 42 for PFAS, 65 for both, 8 for 1,4-dioxane. That number is a little skewed, or both numbers are kind of skewed because of deferral provisions that we put into the regulation, kind of to assist the Long Island communities with the rollout. Treatment, as Arjun and has been presented already on this panel, GAC has been a go-to treatment. It was identified as the best available treatment for PFOA and PFAS when we implemented the regulation. So we do have guidance. We have developed guidance. We are becoming quite familiar with the use of GAC for PFAS treatment. Ion exchange resins is something that we are also looking at in conjunction with work that's being done, or research that's being done with Arjun and the center. I don't believe as of this presentation that we have a formal proposal in-house. I don't know. I know there's some water purveyors in the room. So if you've submitted the proposal, I just haven't seen it now. So don't worry. If it's in, we're looking at it. An advanced oxidation process, that was the only treatment technology that has been identified for 1,4-dioxane. And we've also been working and put together Aop Pilot Guidance. And again, I'd have to really thank Arjun and his research group for the assistance, the co-op that we've had with the health department and his group in the beginning, as far as getting piloting done, setting parameters, looking at data, really informing what it is that we're trying to do on the fly. And with that, I think I will just say, let's call it there. The UCMR5 information I was going to present was just to highlight that UCMR5 is also looking for 29 PFAS compounds, and that there was a change between UCMR4 and this round of UCMR, and that the system size has gone from 10,000 down to 3,300. So we're poised to get a lot more occurrence data from the UCMR5 program. And I would be remiss without at least highlighting the fact that, obviously there is this bill money that is available, but there's still guidance about how it is that we are going to be getting the money from the EPA and then how we're going to disseminate the money. What we do know to this point is that we're going to work it through our Drinking Water State Revolving Fund program. Usually when I give this presentation, it's to operators or water purveyors, and I'm telling them to please, shake down your public water systems, and any administrators, make them familiar with the Drinking Water State Revolving Fund program if they're not already, because there's funding available through that program. So if that happens to be, your sphere of influence, that's what I'm recommending to you as well. Because we are going to try to break that money down into 3 separate pots to get out basically supplemental SRF funding, EC SRF funding, and lead service line replacement money. And so, yeah, I'll end there, or I'll end here with just some dollar numbers on what it is we're thinking is going to be available for New York State. And folks can just digest that. I know we did have a application deadline for supplemental and base programs that was today. Anyone that's familiar with the SRF program, it won't be surprised with these dates because it's typical. This is the time that we start to populate our next intended use plan. And with that, I will say thank you, and I'm only 30 minutes behind.